ladies and gentlemen, we move on to the state-of-the-art lecture that features Professor Rick Levy, Senior Consultant Psychologist and Director at the Levy Centers for Mind, Body Medicine and Human Potential, United States of America, for the next 15 minutes to speak on self-help kit to combat stress. Our chairpersons are Professor G.N. Mahapatra, Dr. N.C. Krishnamani, S.R. Veeramani, Usha Kiran, S.K. Agarwal, I. Livilan, M.S. Patwardhan, and Professor Poonam Malhotra. May I request Professor Malhotra to please join the proceedings. Professor Levy, please, for the next 15 minutes.
Dear friends and colleagues, after having so many sessions on clinical, diagnostic and academic sessions, now we really come to the aspect of preventive cardiology and spiritual cardiology. So, as we have got a very excellent speaker, international speaker from USA, Dr. Ricky Levy, who will tell us about the self-help kit to combat stress. Kindly.
Thank you for having me here. Always a pleasure. Now, look at this list. Chronic stress is lethal. Just read the things on this. We all know how serious these things are. Yet doctors and the public still do not take stress seriously enough. An episode of mental stress causes ischemia at higher rates than exercise. One outburst of anger can cause a lethal dysrhythmia. Chronic stress alters brain neurochemistry and physiology in a way that perpetuates SNS domination even when at rest. Chronic stress reduces gray matter density in the prefrontal cortex, where we have reason and working memory. The limbic brain, the amygdala, and hypothalamus become hyperactive and dysregulated and stay this way. So, India, stress central. Second worst in the world for poor work-life balance, high rates of work-related stress and work-related illness. Second only to Mexico, a failed state run by drug gangs. Stress is the leading cause of depression and anxiety. Due to its rise, the WHO estimates depression will be the #1 leading cause of disease burden by 2030, eclipsing CVD. Hear that? It's an important point. India's lifetime prevalence rate for depression is the highest in the world at 35.9%. 3 times as high as other developing countries, 2 times as high as in the United States. The point prevalence for anxiety disorders is 20% to 25% of the population, or 1 in every 4 or 5 Indians. Now, these problems are worse for Indian women. 87% are highly stressed. This is the highest in the whole world. Depression and etiology of CVD. Depressive disorders and subclinical symptoms like chronic hopelessness correlate with a 2 to 3 times higher risk of developing CAD. That's pretty significant, particularly because these symptoms are very minor looking and you can easily overlook them. Risk for onset of CAD is 4 to 5 times higher for those with severe depressive symptomology, women, and patients facing ongoing psychosocial adversity. We see a dose-response relationship here. Now, depression and CVD prognosis. Depression and subclinical symptoms like chronic sadness are associated with 2 to 7 times higher morbidity and mortality rates for patients with a CVD diagnosis. And I cannot emphasize strongly enough that these risk factors are independent of traditional risk factors for CVD like obesity, smoking, diabetes, and hypertension. Plus, they help to cause the other major risk factors. So, anxiety and CVD. Anxiety disorders and subclinical symptomology, excessive worry, anger, correlate with a 3- to 4-fold increase in risk of AMI or cardiac death in initially healthy subjects. Post-MI, patients with anxiety are 3 to 5 times more likely to suffer subsequent MI, cardiac death, and unstable angina, independent of age, diabetes, previous MI, type of MI, and Killip class. Risk range variance. There's a lot of variance here. Age at onset of stress-related symptoms. The younger, the worse it is. Passage of time, that is the length of study. Now the risk skyrockets to 7 times or more once studies go out 3 to 4 years. Severity of psychiatric symptoms, of course, increase the risk a lot, and exposure to ongoing stressors. And access to psychosocial support, which is often lacking. So, is this a lot of people or just a few? How many patients affected? 2/3 of all heart patients experience clinical or subsyndromal mental illness at some point. Clinical severe depression affects up to 45% of patients post-MI, and it persists in about 20% of patients with CAD and 35% with CHF. Clinical anxiety affects up to 60% of patients post-MI, persists in 33%, and 1 of every 3 or 4 with CAD. 40 to 64% of patients waiting for transplant and post-surgical patients have a psychiatric diagnosis. So treatment really must be provided. But is it worth intervening? Clearly so. Treatment of depression and anxiety show a 43 to 44% reduction in cardiac death and recurrent MI. Hear that number. If we can get a 5% reduction, 3% with a good medication, we're happy. These are real numbers. I'm not making these up. 43 to 44%. And these results are startling because treatment provided in these studies was far less than standard of practice. In my own clinics, where we follow best practices standards, 2 out of 3 patients show a full return to good physical and psychological health. In the United States and Europe, treatment of psychological distress is a medical specialty called cardiac psychology. So what works in cardiac psychology? First of all, psychotherapy is highly effective, with 3 types having been proved effective for cardiac patients. That's cognitive behavioral therapy, interpersonal psychotherapy, and emotionally focused therapy. Now, clinical hypnosis is moderately effective. And interestingly, SSRI antidepressant medication is in fact no better than placebo. But look, we're glad to get the placebo effect. Meditation is not strong enough to be a standalone treatment. It has mild to moderate effect on mild to moderate depression. In my clinics, we combine all 4 approaches. Now, it is so easy to screen for depression and anxiety with AHA two-question screeners for each. Look at the, first of all, for depression here. Just take a look at this slide. You see, read it quickly. You'll see how simple it is. This is easy to screen for. And then when you look at the next slide here for anxiety, and you look at that one, you see equally, very quick and easy to screen for. It takes about a minute maybe for the patient and 15 seconds for the nurse to score it. And we've got good sensitivity and specificity figures. Now in the US, we combine these two screeners into a 4-question screener called Patient Coping Skills, destigmatizing the mental health issue. Hospitals and large practices have their own in-house cardiac psychologists, while smaller practices refer their patients to someone like me. Now, I regret to say that India does not really have psychologists. There are people called psychologists, but in the United States, they would be considered technicians. Even the few PhDs have only half of the 7 years of education required post-UG in the United States. And I think you'll find as medical doctors, if you talk to various psychologists in India, you don't find them to be equal in knowledge and experience that you have. They're really not psychologists, I'm afraid to say at this point. To solve this problem, I developed a patient self-help kit with a 50-page manual and 4 audio recordings taking patients through the exact methods as I use them in the office. They are designed for independent patient use, so easy a child can use them. The patient just sits back and listens. The kit covers the 5 pillars of mind-body medicine, including diet and nutraceuticals, exercise, sleep, special problems of sleep, of obesity and smoking, and proven stress reduction techniques. Now, patients enjoy using these methods so much, they use them a lot, driving up overall patient compliance and health outcomes. So, what are these? These 5 extreme de-stressors of the mind. They are disease-specific protocols combining psychotherapy, clinical hypnosis, and meditation that allow patients to go much deeper into their minds to affect healing more powerfully than any of the methods used alone. They are used privately, at home, so avoid stigma. The first one, the Stress Buster, in 14 minutes, it typically reduces stress 50%. Second, Catharsis, takes people into releasing the emotions that are creating harm in their body, often by taking people back to earlier events that may have helped cause the emotions that helped cause the heart disease. Power Surge. This one is designed to strengthen the mind to be a powerful tool, like a surgical technique or like a powerful medication. But I'm telling you, you got to get the mind a lot stronger before it's good enough really to help you heal CVD. Hypnotic meditation. When someone uses a hypnotic induction, and here I don't mean mind control, I mean clinical hypnosis, relaxation procedures, and then meditate, people go much deeper into the meditation and they immediately get the full benefits without the monkey mind wandering thoughts that typically come in meditation for at least a year or 2. And then cognitive reprogramming, a simple technique from cognitive behavioral therapy that lets patients discover and reprogram subtle distortions in their thinking that are fueling stressful, unhealthy emotions. Now, every heart patient needs this kit. not just post-MI patients, but those with hypertension. Also, it is needed for people with related diseases like diabetes and metabolic syndrome that may lead to heart disease. So, go to powertohealit.com or drricklevy.com, click ebooks and manuals, put in promo code BARA to get and download to get the kit for the greatly reduced price of about 325 rupees. Charitable public institutions can contact me by mail to receive the kit at no cost. It will be available in hard copy in print with 2 CDs by the end of October on Flipkart and Amazon India for less than 500 rupees. This is what it looks like. 50-page manual, 2 CDs. My purpose is not to make money. It is to serve. Now, we have a good number of hard copies of this kit to give away to you, which are located at the registration desk. If you go there, you'll see on the counter there's a good number. Just take one, please. Particularly, we really want to get these into the hands of the doctors because you can get these out to the people. So we're giving you this at no charge. Thank you.
Yeah, I have a question regarding this, your thing. So there are 2 types of stress. One is what you talk about, persons, young, old, middle-aged, who are undergoing different types of stress. That is one group of patients. And another group of patients, which you have very correctly pointed out, having history of myocardial infarctions, known heart disease patients. So I want to know that if suppose a known myocardial infarction patient where the angiography shows that there is a 90%, 80%, 100% lesion with symptom, without symptom, how do you take up those patients for your stress buster?
Yes. You still can reduce the stress greatly in this. In fact, if you go to, it's a complicated question, but if you go to the Journal of Clinical and Preventive Cardiology 2014, you'll see I have a long review article with over 300 references there, which will really let you start to pour through that and see the best way to do it. But you definitely can get the stress down in these people also.
Yeah, thank you, Dr. Levy. You have really opened up the mind of everybody. But what question has been asked, I would also like to add. I am working as a cardiac anesthesiologist in All India Institute of Medical Sciences. And I'm working over there for almost 30 years. I have a good experience of the cardiac patients, as you asked. And that is that we get a patient who is 15% ejection fraction. And being surgeon anesthetist together, they just weigh. Because transplant is not possible, heart transplant in such a patient. Still, we are doing bypass surgery, though with lot of stress giving to them. One of the patients asked me, you are telling me the risk, and then you want to do surgery, and then you want to make me stress-free also. Rather, you are giving me stress by asking for the consent. But we have a Raj Yoga meditation program in the hospital for the patient and addition for the relation. Because cause of the stress is not just the patient himself. It's the relation, their vibrations are affecting them.
Yes,
So
let me make a comment on that.
Yeah, that is a very important thing. Yeah.
Yes. The key here in getting rid of stress at levels far beyond what you are used to seeing being able to be done is to go very deep into the patient's mind to get this type of release. There are 4 levels to the human mind: conscious mind, subconscious mind, individual superconscious mind or soul consciousness, and universal superconscious mind or divine consciousness. The vast majority of time when people are doing stress reduction work, it is way too light, and it doesn't bring about the kind of things you need that you're pointing to. I agree. You just get into conscious mind, basically, maybe a little bit of subconscious, but it just doesn't go deep enough. It is very essential to use powerful levels of hypnosis combined with these
But do you
methods.
feel that what he has mentioned, the patients having ejection fraction of 15% and whatever modalities, whether you use PET or anything, showing infarcted scarred myocardium, and what he has pointed out is the only case is transplant or stem cell things which will help. But in those type of patients which you try for meditations and state bursting, will it help?
Well, just recently,
But do you have a follow-up study?
Just recently, I took someone with a left ventricular ejection fraction in the lower 40 percentiles, 42, 44, something. Doing this work, we jumped it up to 65%. We also took several cases of severe mitral valve prolapse that were requiring surgery. And with these methods, dropped them down so far into simply mild mitral valve prolapse, and they didn't even need medication or medical treatment after that, simply had to come back for an echo and another halter in 3 years.
Thank you.
So one can bring about changes that are surprising.
Thank you very much.
One thing I would
Professor
like to add, that though the ejection fraction doesn't improve, but their quality of life very much improves, and they are living as a normal human being. I remember one person coming from Odisha to Delhi. That must be really 24 hours train journey. He used to come alone. He said, look, I'm doing meditation. I'm not worried. God is with me. And he used to usual person as the other person is having.
These are sporadic cases. These what you are talking are examples, sporadic cases. If a patient has got a dead infarcted scarred myocardium with an ejection fraction of 15%, what meditation would help? Nothing would help. Only symptomatic treatment you will help. That's all.
Thank you very
But
much.
meditation
Mr.
will
Chairman.
help. See, to meditation to help, you will have to have ischemic myocardium. You will not have dead myocardium.
Sir, let us agree to disagree.
Totally run out of time for the...
Japanese studies have shown that stress-induced Takotsubo syndromes, within 72 hours, the transcendental meditation can make them from 15-20% ejection fraction to normal. But that is only stress-induced Takotsubo syndrome. It doesn't apply to the other chronic conditions.
Okay, thank you very much, chairpersons, and we'd like to thank Professor Levy for being here with us to deliberate. And as a mark of respect to Professor Levy, I'd request our chairpersons to please step forward and present him with a citation. Thank you very much, Professor Levy, for being here with us and enlightening